Good morning. My name is Mary Leonard. I'm chair of the Department of Pediatrics and director of the Maternal and Child Health Research Institute, and it is my great pleasure to welcome you to the fourth annual MCHRI Symposium. Last count, we had more than 500 people registered for the meeting. This is a wonderful opportunity to celebrate the diversity of the MCHRI community. We now have 950 members. This is more than doubled over the last 5 years. And our membership reflects our very strong commitment to future leaders in maternal and child health. For example, we have 15% postdocs and fellows and 50% early career instructors and faculty, with the remainder being mid-career and senior faculty. Our membership also reflects the diversity of the faculty committed to maternal and child health across the entire campus. We have members from 5 other schools with deep partnerships, in particular with engineering, education, humanities, and the sciences. And our membership also represents all basic science departments and all clinical departments. In fact, only about 30% of our membership is in pediatrics. The diversity of our membership is reflected in the diversity of our grants. We were privileged to give out more than $10 million in funding last year. So let me give a special thanks to the more than 100 faculty who reviewed grants across 13 different study sections, and to Kim Stern, who coordinates the submissions. Our research funds the entire translational spectrum, from fundamental discovery to health policy. And during the breaks, you'll have slides that rotate, and this will highlight some of our partnerships with other institutes and centers across the campus. I also want to make a note that in the last year, we were able to establish new funding mechanisms to look at the effects of structural racism and social injustice on maternal and child health. And this will be reflected in today's program. And we also launched a program called DRIVE, which is a program for underrepresented minorities, first generation and low income undergrads to work in the labs of our faculty. So special thanks to the faculty who took on the DRIVE participants over the summer. We have many people to thank today. I want to thank the MCHRI team, Mary Chen, Grant Wells, Netta Miller, and everyone who worked behind the scenes to put together this wonderful symposium. I also want to give a special thanks to Tony Oro, who conceived and chaired the education committee, and you'll have a chance to see the different members of the education committee as they moderate today's sessions, and you'll see them on the slides. I want to thank Dr. Moley for joining us today. We had a wonderful small groups discussion with her yesterday with some leadership across the School of Medicine. The people who will follow me, Dean Miner, Cynthia Brandt, and Paul King, representing the school, the foundation, and the Children's Hospital, provide the funding that makes MCHRI possible. I will join you a little bit later in the program when I present the Visionary Leadership Award to Dr. Bonnie Maldonado. And with that, I'll transition to Dean Miner. Thank you.
Well, thank you very much, Dr. Leonard. And Mary, I want to thank you for your extraordinary leadership, which is so palpably evident in the success of both the Department of Pediatrics and also of the Maternal Child Health Research Institute. Thank you, Mary, for all that you do for Stanford Medicine, and for the world through your leadership. And I want to extend a hearty welcome this morning to guests who are joining us from afar, and also to our colleagues here at Stanford. I think the MCHRI reflects the very best of Stanford University and Stanford Medicine. As Mary indicated, they're participants, active participants in the programs and activities of the MCHRI, stretching all across the 7 Stanford schools and throughout all aspects of the Stanford Medicine enterprise. And it's this convergence and collaboration of people who have so many different talents, abilities, and areas of focus that enables the MCHRI to have such transformative impact. And that impact extends across a spectrum of activities, from very fundamental biomedical research that's elucidating, for example, biomarkers that portend and indicate a propensity for preterm labor, a condition that continues to threaten the health of moms and their children in our country and around the world. So very fundamental discovery and early stage translational research, all the way through the spectrum to research devoted to research and activities devoted to understand and have an impact on the social, behavioral, and environmental determinants of health. We know that these social determinants of health account for roughly 70% of overall health outcomes, and they're particularly evident in an oftentimes disastrous ways in the health and well-being of moms and their children. I'm particularly pleased that the MCHRI, through the Office of Child Health Equity, is supporting pilot grants such as the grant entitled Structural Racism, Social Injustice, and Health Disparities in Maternal and Child Health. It takes a multidisciplinary and interdisciplinary approach to really solve the critical issues that affect the health and well-being of mothers and children. And I think the MCHRI is defining the pathway of how to do that and leveraging the vast resources that exist within Stanford Medicine and Stanford University to have truly transformational impact. I know today's symposium is going to be really exciting, and I want to congratulate and thank all the participants for the work that they've done leading up to this symposium and for the important work that they'll continue to do in the days and weeks ahead. And now it's my pleasure and privilege to introduce Paul King, the President and CEO of Stanford Children's Health. Paul?
Thank you, Lloyd, and good morning, everyone. I'm so glad we're taking time today to spotlight the important work coming out of the Maternal and Child Health Research Institute. Stanford Children's Health is proud to support MCHRI, which plays a vital role in enabling research discoveries that lead to better care and healthier outcomes for our patients and families. Our collaboration has helped to develop critical initiatives like the Clinical Research Support Office. We appreciate all that you've done and continue to do in that area. I believe the timing for today's symposium could not be more urgent. As Lloyd mentioned, the pandemic has exacerbated longstanding health disparities, especially for women of color who are expecting or raising children. As an organization, there are many things we can do to reduce and hopefully eliminate these disparities. To do so, it's imperative that we prioritize health equity across our research, education, and care programs. With this in mind, I'm thrilled that the MCHRI will be supporting our newly established Office of Child Health Equity. The office has a goal of reducing childhood health disparities locally, statewide, and nationally. What I think is particularly special about this new office is its multifaceted approach. Not only will it support research into child and maternal health inequities, it will also advocate for underrepresented families in our community and for changes to health policy. Across these areas, the office will have a strong focus on translating research findings into tangible improvements in patients' lives, in and outside of our medical clinics. Through this approach, we hope to make a real difference on pressing issues like food and housing insecurity and unequal access to high-quality care. Today, you'll hear from many of the pediatricians and researchers who've joined the Office of Child Health Equity. I want to thank everyone speaking today and all of you in attendance for the fantastic work you're doing to help parents and children live healthier and more fulfilling lives. It's now my honor to introduce Dr. Cynthia Brandt, CEO and President of the Lucile Packard Foundation for Children's Health. Cynthia.
Thank you, Paul, and good morning, everyone. We are here with a shared purpose to get to better health, better lives for moms and kids and families. And here at the foundation that I represent, the Lucile Packard Foundation for Children's Health, we are all in on that mission. We are here to unlock philanthropy to transform health for kids and moms. And we know that the answers to better health lie in research, and there is no better place to make that kind of progress than here at Stanford. We have the incredible Children's Hospital in walking distance to just the very best minds in medicine and science and engineering and business, law, all the things that Lloyd and Paul have been talking about. There's so much potential. Sometimes the only limiting factor can be access to funding. And it's our responsibility at the foundation, working with all of you, to ensure that funding does not slow down the work, that in fact philanthropy can accelerate discovery. Donor support often allows us to be creative, to be ambitious, to be more nimble than we could be to work on some of the most challenging problems in maternal and child health. So through philanthropy, early career investigators get off the starting block. We have a great example today. You'll be hearing from two professors, Drs. Casey Gifford and Mark Schuyler Scott. They are two of the first scientists recruited to Stanford with a generous gift from Gordon and Betty Moore for the Basic Science and Engineering program. It's called BASE. And it's a program led by Dr. Marlene Rabinovich to find out how we can prevent and cure congenital heart disease. This is a big bet program. And at the foundation, we're really proud to support that kind of work. Of course, at Stanford, our goal is not to make the discoveries and keep them to ourselves. It's how do we improve care and cures and take that out to help moms and kids and families around the world. And some of the things philanthropists support are programs that tackle really pressing challenges with that goal of figuring things out and then taking cures out beyond. So here through the MCHRI, we have donors funding research on really critical conditions, including inflammatory bowel disease, single ventricle heart disease, the genetic disorder 22q11. And behind each of these programs is a donor family dedicated to helping us find answers that then will benefit kids and families around the world. So we're so proud that philanthropy can help support that kind of innovation and support all of you in the work that you're doing. We're really proud to partner with you, to partner with Dr. Mary Leonard and MCHRI on this work. And I want to say thank you all for the incredible drive and ambition and collaboration that you put into this work. Now it's a pleasure to introduce Dr. Tony Oro, co-director of the MCHRI, and as you heard, chair of the educational committee at MCHRI that organizes this great symposium every year. So let me turn it over to you, Dr. Oro.
Thank you very much, Dr. Brandt. I'm Tony Oro, professor of dermatology and MCHRI co-director. And on behalf of the MCHRI Education Committee, I want to add my welcome to the 4th annual MCHRI Symposium. The Education Committee has worked hard to put on this event and identify the key emerging research areas, and I really want to thank them for their tireless effort. I also want to thank the MCHRI leadership that you just heard and their incredible support. We are fortunate as an institute to have the philanthropic support from the CEO of the hospitals and School of Medicine that allows us to do this kind of maternal and child health research well. I also want to highlight the outstanding posters that were submitted that are available offline for you to peruse. We have 92 outstanding posters that provide the latest maternal and child health innovations. So please take the time during the breaks or at lunch or the next week or so to read them and contact the authors for more interactions.